here, who's an applicant for the Human Services Advisory Board. Would you come forward and tell us a little bit about yourself, Lisa?
Some humorous anecdotes, if you got them.
This is kind of intimidating. My name is Lita Casper. I am currently the coordinator of community partnerships for Rochester Public Schools. I grew up in Appleton, Wisconsin, and
Hey, that's good. We like Wisconsin.
Go Pack.
Yeah.
I started teaching. Went to the University of Minnesota. Started teaching in Bronx, New York. Spent 2 years over there. Was super interested in people, culture, humans, what makes us human. And I moved to a rural Yupik Eskimo community in southeastern Alaska for 5 years, where I actually met my husband, who's from Winona, and he's also an educator. And we actually ended up moving here roughly 9 years ago now. So my interest in this board is really connected to improving the lives of people in our community. And those are kind of the areas of expertise that I bring. Just curiosity and interest in humans and improving our community.
Great. We need new people and we need young people. So
That's right. Any questions? No. All right. Well, thank you. We'll get back to you. Appreciate it.
Yeah.
Okay, we'll call the meeting in order. We'll start with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic which stands, one nation under God, indivisible, with liberty and justice for all.
All right, start with consent agenda. Approve the November 1st minutes. The 2023 Public Health Nursing Service Contract Rate and Fees. Adoption of revisions to the existing Chapter 400 policy. Accept mobile crisis grant for the adult and children's mental health crisis response services in southeast Minnesota Crest counties. Approve 12-month lease agreement between Olmsted County and Doc's Recovery House. Approve the Edward Byrne Memorial Justice Assistance Grant JAG Program Fund allegation and MOU with the City of Rochester. Approve Southeast Minnesota Emergency Communications Board Memorandum of Understanding contract for call premises equipment. Adopt the updated aquatic invasive species prevention plan and resolution. Enter into detour agreement 1051836 with MnDOT. Establish public hearing date to discuss the 2023 to 2027 capital improvement plan and authorization of the issuance of capital improvement plan bonds. Renew agreement to provide professional service to the Southeast Minnesota Recyclers Exchange. Renew agreement to provide fiscal management services for the Southeast Minnesota Recyclers Exchange, and proclaim November 16th, 2022 GIS, Geographic Information Systems Day.
Move to approve the consent agenda.
Second.
All in favor, say aye.
Aye.
Passes. Okay, regular agenda. Discussion decision items, allow reimbursement for future tax exempt bond issue.
Good afternoon, Commissioners. Cammie Iverson, Controller for Physical Development. This is a standard action that the Board must approve when we intend to issue bonds for projects that we will most likely start prior to the issuance of bonds. So at the December 20th Board meeting, we're going to ask for your approval of the CIP, Capital Improvement Plan. And in the CIP, there's approximately $24 million of bond-funded projects that we'll be asking you to approve. Project managers will most likely start on those projects in early 2023, but we won't issue the bonds normally until second or third quarter. So that we ask you to adopt this resolution, which will allow reimbursement from the future bond issues for those CIP projects.
Okay, any questions?
Can we ask questions about the CIP now or just about the bond?
I think just about this one, you'll have a chance at the public hearing, but if you have a question and I can answer it, I will.
Well, I had a question about the MRF. I see it's $20.5 million, right?
I think so.
For the MRF. And then later on here, it's $2 million for the engineering and design.
Mhm.
It seems like there's other MRFs that are already built, what is going to make ours so different that it's going to take $2 million to design and engineer?
That I'm not sure of, and I can
Yeah.
tell you. Oh, he's right there.
So yes, Tony Hill, Director of Environmental Resources. So the question about the MRF is, what we're doing is we're planning on design and engineering next year, and that's the cost. It's going to be under $2 million. That's just what we have right now slotted. But we know that the design and construction, the design and engineering is going to be under that. But there could be overage, and that's why we just wanted to plan for the $2 million. What we know right now is that the request we have for state bonding right now is the $10 million for state bonding to match our what's going to go into the construction of it. And we know that through was the MRF. And so just with inflation, that cost has gone up. But we'll come with its design and engineering, we'll come up with a better number for you. And that's what that's
it's
about.
It's a placeholder, sort of.
Yeah, so it's a placeholder.
Okay.
Yeah.
All right. Thanks, Tony.
Yes, thank you.
Motion to approve.
Second.
Okay, all in favor, say aye. Aye. Opposed, carries. Thank you. All right. 2022 Community Health Needs Assessment Presentation and the Identified Community Health Priorities.
Good afternoon, Chair Tyne and Commissioners. My name is Mike Mielis. I'm an Associate Director of Public Health. And we are here today to share the 2022 Community Health Needs Assessment. This is a process that cycles every 3 years, and it's through a collaborative partnership with Olmsted County Public Health, or Olmsted County, and Mayo Clinic and Olmsted Medical Center. And we have our partners here with us in true collaborative form to present the needs assessment to you. I should also note among the core group of Mayo and OMC and Olmsted County, we also have funding members United Way, Rochester Area Foundation, and Zumbro Valley Health Center. We've been completing community health needs assessments in 2012. This will be the fourth cycle. And actually this past year, you'll see in the presentation, we've tweaked and changed and improved some things about it. We've had a record number of respondents and input to get as much information as possible. And we're excited to share the 2024 priorities, the new priorities, and also a pretty cool new platform that will replace the report. It's actually an interactive website. So I'm excited to share that with you. I'd like to introduce the others who will be joining me today. Holly Hess is a program manager of our PMQIA team. Dr. James Hoffman is representing Olmsted Medical Center. And Dr. Brian Lynch is with Mayo Clinic. A little bit of difference there. And so at this point, I'd like to turn it over to Holly.
Could I ask a quick
Yes.
question, Mr. Millies? I was just reading something from the National Association of Counties. They were polling counties. I'm on a health committee for them. About, they were polling counties about what we're doing in the area of mental health particularly. But it got me to wondering if the community health needs assessment process, I can't remember, I should probably know this. I believe that all not-for-profit healthcare providers are required to do a needs assessment. I'm not sure if it's federal requirements for all public health departments to do one. Is that correct?
Anything that might come from the federal level would be probably a recommendation and guidance, and it would fall under the Public Health Accreditation Board, which we are accredited. But also with the state of Minnesota, we have the Local Public Health Act, which has requirements in there to do certain things. In there, you'll see that community health needs assessment is a component in that state statute, actually.
And am I correct that it's unusual to have this joint effort of both a combined public-private partnership and doing a community health needs assessment?
Well, I can't speak, across the nation, but I think it's wise to do it in a partnering way, because then you have an entire health system, public and medical, coming together. And you'll see in the presentation, there are some slides where it specifically talks about the requirements the medical side has, and then also the public health side has. So the entire health system then, partnering now together here locally just makes a lot of sense. And that began in 2012, I think. At the time, our director of public health was Pete Beeson. He's helping.
as I recall, part of it was the medical centers were put on a 3-year cycle to
Right.
do this. We were on 5, and so
5.
we simply merged it to say, let's be efficient and
Everything.
take care of it together.
Yes, exactly. Yeah.
Full disclosure, since the National Association of Counties is looking for innovative programming ideas to share with other states and counties, I wondered if that was something we should be highlighting and offering
Yeah.
as a model for others. So
Absolutely.
that's the reason for my question. So,
Yeah, excellent. And you'll see that we've benefited from some really skilled staff that have helped us build like the interactive platform, and we're excited to show you. Yep.
Good afternoon. So I'm just going to share a little bit about the community health assessment and planning process overall. So the CHAP process, that's how we refer to it, the CHAP process, is a 3-year cycle, like Mike mentioned, where we assess the well-being in our community and identify health priorities based on that assessment, design strategies and interventions that go into our community health improvement plan, and then report on the efforts on an annual report basis. And like Mike said, we do that in conjunction with Olmsted Medical Center and Mayo Clinic and lots of other diverse partners within the community. This slide just shows an infographic that kind of depicts the cycle. So as Mike mentioned, it is a 3-year cycle. So we're in those 2 dark circles right now with the assessing and prioritizing aspect. So that's what the CHNA or Community Health Needs Assessment aspect is. Then that feeds into the CHIP, so the Community Health Improvement Plan, where we, like I mentioned, plan for strategies, implement those strategies, and then evaluate the effectiveness of those strategies. So that's kind of an overview of the CHAP process. Now I'll hand it over to Dr. Hoffman to share all about our 2022 CHNA.
Thank you. Thank you. Just what is the community health needs assessment, and why is it important? We view the CHNA as a way to broaden hospital-based healthcare delivery systems to include health issues beyond their walls and incorporating the greater community. Just echoing what Mike said, I think that this is a rather unique, probably not unique, but a rather unusual arrangement that we have between these 3 entities. It's been truly a wonderful collaborative process, and we're about to enter into the 4th iteration of it here, starting with our process now. As kind of quoted by the Minnesota Department of Health, a community health needs assessment identifies, describes factors that affect the health of a community. And I think most importantly, this is data-driven by a survey that we put out that's analyzed very completely. And it includes collection and analyzing the data and using data to prioritize and make decisions. Why we conduct a community health needs assessment, there is certainly, as we had alluded to, there's some regulatory requirements as such. As being a hospital provider through the Affordable Care Act, we are required to come up with a 3-year cycle of community health needs assessments and then annual updates that we need to report. This is above and beyond the IRS requirements for being a non-for-profit organization. But beyond that, I just think it's wonderful practice. I think it's important that this is a way for us to share data with our partners and residents of the community. It's a way for us to collectively assess community's health and well-being. And I also think that this is an avenue where advocates in the community and community organizations can actually interact with our hospital systems. So that is the CHNA process, and I'd like to turn it over back to Mike to talk about timeline and platform.
Okay, so the timeline actually, we got it here on a slide, and it reflects a fairly busy, complicated, overlapping set of things that we went through to get to where we are now. Starting with developing the community surveys, using our staff skills to understand how to ask the questions so you get accurate information. You can see that just the development took many months in prep for actually sending it out to the community. A lot of things go into that, certainly the language that's used, making sure that we get as much response and diverse response as possible. Moving to the discussion around migrating to a platform, the groups that regularly work on this, CHI and the core group, working to try to understand how can we improve, and you'll see we actually have a quality improvement project that came out of this. And the platform, I think, is part of that. It's an easier way to get the information in the hands of the public, decision makers, staff, medical professionals, and the population. And we'll be showing you at least an example of that soon. And in fact, it's live now, and the links will be shared, I believe, in a news release that will be going out today, if it hasn't already. So then the community surveys were distributed between November and January of 2022. We then began building the platform, preparing for that data and information to come back. A lot of it was responses from the public, but also the raw data, rates of incidence of death or disease. And so that all combined into building that platform out. Then once we were able to get all that information, many of the groups, not just the core and the collaborative community health integration group, but many groups worked on providing input on prioritizing the measures, the indicators, what are going to be the priorities, and we'll show that very soon. But that helped, that was important because we integrated that also into the platform online, both the current 3 priorities and the next priorities that we're moving to. And of course, here we are now with releasing the CHNA today. This is the homepage of the platform. It was obviously designed to have some visuals and to be fairly easy, hopefully very easy to navigate. And one thing that I would say about this is that it's going to have a variety of measures related to it. And once you get into each of those sections, you'll have more measures to look at. For each measure, there are a variety of components that you'll be able to look at as specific data that, or specific, I suppose you would call them, aspects of the data or the indicators. Things like clearly defining what the measure is, what the indicator is, so we're clear what we're talking about, the prevalence of it, what the trends are in our community, comparing our local data with the state and the nation data, to kind of see where we're at. And I think you'll see we included in the request for county board action that we do we tend to be favorable in terms of data, but we definitely have some things that we need to work on. There's a really important component that was worked into it that shows comparisons in terms of equity among populations, all kinds, age, race, ethnicity, rural, urban. And that's really helpful to understand what are the specifics around equity for each of these measures. And there's certainly community health importance, so people, everyone, staff, decision makers understand what's the importance behind the measure. And we also included, I thought was really great, community thoughts, actual quotes from the responses from the survey, so you get a flavor, you get a message from them. And then of course the data source is so important to make sure it's traceable, and people need more information around the data. And this is to kind of describe the quality improvement process, that project actually that we went through. And it's important to note that public health, in terms of our goal in being accredited, there are, I suppose you would say, requirements, but mechanisms to make sure that we're always advancing. And so continuous improvement, quality improvement is an important part of it. And our partners joined in with us to have a project really to increase our ability to communicate better and engage the community with the information we have. In this CHNA cycle, let's see, we thoroughly reviewed the survey. It spoke a little bit about that earlier. And looking at the questions around financial wellness and ability level, enhancing existing questions around gender identity and sexual orientation, understanding some trends and changes that were occurring, creating 2 new indicators, STI and STDs, and youth sexual behavior. In public health, we've been monitoring the STIs and STDs, implementing 2 additional CHNA survey samples, specifically for communities of color and the rural community, to try to get a better representation for those populations. Creating an interactive platform, which you saw the front homepage, and if we don't have a link, we'll get that to you soon. Using CHNA data in a collaborative process to apply for and receive 2 health equity grants, one through a rural health and one through UCare, which will help us communicate better, maybe even translate, be able to reach out to the more diverse and vulnerable populations. And finally, forming a work group to identify strategies to create simple, concise communication, understanding that as we were getting, I guess you would say, feedback from the community, there maybe wasn't as clear of an understanding about what the CHNA process, the indicators, the community health improvement plan is. And so we want to make sure that we can do all we can to streamline that, get it more clear. So
Hey, how are you?
Great.
Yeah.
How are you?
Where we are.
Right. We didn't plan that. And so that summarizes the quality improvement efforts. Let's see, and I think, is it not going here? You might be able to advance the slide.
Embarrassing.
Okay, and now I think it's time for the big reveal for Dr. Brian Lynch.
Hello, welcome. So I'm Brian Lynch. I'm a general pediatrician at Mayo Clinic, and I'm our physician representative to this outstanding coalition that's been tasked with completing this community health needs assessment. And I get to do the announcement here of the top 3 priorities. So I'm the lucky one. So here they are. So for 2024 to 26, our priorities are mental health, drug use, and access to care. For those of you who remember, mental health and drug use were on our CHNA 3 years ago. Access to care is a new one. And this includes access to medical care, dental care, and mental health care. So these key data points kind of show why these rose to this priority. 34% of Olmsted County adults report having any mental health care issue in 2021. We have high rates of depression, higher than reported in Minnesota in adults and through the United States, with 25% of adults reporting that. 17% of Olmsted County adults report using illicit drugs in the past 30 days. And access to care, 32%, nearly a third of our adult population say that they delayed any type of health care in 2021. And one of the reasons is cost. So obviously our next steps will to explore better what are driving these needs, but at least we know what they are currently. So our next steps are first to share with the community through that outstanding website these results. Then we continue to work on this process to implement strategies and develop strategies that we can roll out. So 2023 we'll be developing strategies for these 3 priorities, and then they get rolled out in 2024. At the same time, we're still working on the strategies from the last CHNA, which again includes 2 of the 3 for this one. So that work's also going to continue at the same time. So with that, we're ready for your questions for us.
So I'm Dr. Liz, don't necessarily want to put you on the spot for this. It's maybe more to our community health improvement plan. Since we've had mental health on the issue before and drug use before, what strategies are we pursuing and what kind of outcomes are we seeing?
Well, I can start. Well, we can let a few join in this one, but there's been a number of strategies. I think the biggest is development of the Southeast Regional Crisis Center. So this is a center, community health center created in 2021 that essentially serves mental health needs of the community. And it's for people having a mental health crisis, either adolescents or adults. It serves the 10-county area here in Southeast Minnesota. And certainly it's a whole collaborative team that runs it. And what's nice is anyone can come there no matter what their financial needs are. So I think that's a big one, you know, in terms of trying to address mental health needs and then building on that. Certainly, there's also been a lot of support provided to agencies in our community that can increase access to care to mental health. So we're trying to build up the private, especially nonprofit agencies in our community which provide mental health care. So that's been another big part of the work over the past 3 years. But we're going to develop new ideas. That's the idea. We'll build on what we've done, and then we'll move forward with newer innovative ideas that can address this need that's around the country. It's not just here in Olmsted County.
Yeah, actually, if I could just do a follow-up, Mr. Chair. Our legislative committee has been working on what we're going to take forward to the legislature next year. And one of the things that's been evident for counties all over the state is that we don't have a continuum of care for mental health treatment. We particularly don't have residential care facilities for adolescents. I'm looking back at the sheriff. I mean, we have a lot of issues with not having that continuum of care. So I just want to suggest that as Mayo goes forward with your legislative agenda, that advocating in terms of some of the things counties see in terms of state responsibility to assure that a continuum of care can exist would be wonderful to see added to your legislative agenda, because counties have it as one of our top priorities coming up into the coming year. Came from public health, but from social services and from law enforcement. And we have it as a top priority, but oftentimes counties, because we're seen as a creature of the state, the legislature doesn't necessarily listen as closely to us as they do to other kinds of sectors. So I just ask that you consider taking that back through the Mayo channels to talk about this lack of service. You've done a great job of stepping up to make sure we have that crisis center here. And I know you still have backlogs in your emergency department of people who we can't place, but we need to be of one voice cross-sector on this important need for our people. And then I'll have a question later, but I know that I saw my colleague down at the end of the road had a question here too.
Mr. Chair, yes, I've been discouraged over the years about our difficulty in finding psychiatrists to come here. And I was just thinking about climate change and how it's actually turning out that this is sort of paradise here in terms of storms and awful things happening. So I'm hoping that we will get more psychiatrists, because it does seem like that's one of the things holding us back, if I'm reading things right.
Certainly, but there has to be multiple approaches. Even if we were lucky enough to recruit double or triple the number of psychiatrists, it's still not going to be enough. You know, we're working as myself as a primary care doctor, getting training to care for patients with mental health needs, and getting expanded training so maybe I can take care of the patient that historically I would have had to refer to a psychiatrist. So
that's great.
So there's a lot of teamwork, and it's a teamwork with all of our community organizations, and it starts, you know, with our schools. It starts with our communities. We all have to work together. We can't solve mental health problems alone in a clinic. We need a team effort, and that's, I think, one of the reasons it's such a challenging issue is it takes a new approach.
So if I'm hearing you right, you're saying that we have expanded the disciplines that can offer mental health medication.
Mm-hmm.
That's well, I must be.
Any other comments from my team
Great.
members on that question? 'Cause that's a good one.
Yeah, it's a multi-pronged approach. It can't simply be physicians and psychiatrists. It's precisely what you're alluding to is partnering with our advanced practice clinicians, our nurse practitioners, they're providing great care. Really, one of the amazing things that came out of the pandemic was our ability to leverage e-health, and to be able to deliver on that platform is important. OMC is working with trying to do more group sessions where you have
It's amazing how many patients find comfort, like let's say in a group depression type of group setting. That way you can be more efficient too. So it is definitely multi-pronged.
Great.
But if you know a good psychiatrist, send them our way too.
Mark, I have a question.
Commissioner
I would
Flynn.
also like just to add one thing too, in terms of the acute care for mental health, and from a public health point of view, we recognize how important it is to get upstream if possible, to reduce or to at least acknowledge the mental stressors that are happening, maybe the more subtle, maybe more chronic mental health issues, to try to understand what can be done there too. And so that's an important component. We realize when the acute care is in need, like the crisis center, you need it. It's got to be there. But what can we do as a health system to get upstream and as maybe start to address some local but societal issues too. So prevention.
Okay, Commissioner Flynn.
As you study this next year at the state, there'll be a big push to legalize marijuana. Is the medical community going to weigh in on it, like the Sheriff's Association? County boards will be weighing in on it. Is the medical community going to give their view on it? Well, we talk about studies. Are we going to back it, or what are we going to do? And just talk, oh, it's a problem. So here's something going forward. Is the medical community going to put their say into it? Because they'll carry a lot of sway or weight in this decision.
Yeah, I certainly don't have the authority to talk about what may decide, but I think it's a really important issue we need to bring back and discuss, because it will be an issue that's going to come to the table here in Minnesota, just like in other states, and the medical community input is important. So, but I'll have to leave that decision to those who are kind of,
But aren't you one of them making the decision, though?
Well, I work with this community health needs assessment, but marijuana legalization is not a something that I'm working with key stakeholders at Mayo Clinic right now.
Mm-hmm. Commissioner Cascade.
I'd like to go to the third finding about delay in healthcare services, and I'm wondering what we are a state that is among the top of the nation for health insurance coverage. But of course, we also have co-pays and other things that are disincentives. But I'm wondering what more do you know about that as one of our key priority areas? What's underneath that? Is it language? Is it culture? Is it healthcare? Is it co-pays? Is it what do we know about why people are delaying? Is it the change in procedures? So the world famous Mayo Clinic has new procedures that don't let the patient have as direct access to their physician as they used to. What are the factors that are driving that? Do we know?
Yeah, I would say we don't know for sure yet. That's what the next year is about, is to gather that information in a much more detailed form. Here we're identifying the priorities. Now that we have them, now we really want to understand them better. So
can you tell us what you heard? How did you come to that conclusion? What were the questions asked, or who was asked? How do we know that?
One thing that is important to know about the community health needs assessment is it gives us a high-level understanding of all these measures, and we get input directly from the community. And the key to surveys is getting a clear question that you get something substantial back, but it doesn't have the depth in it that we probably need to really build that plan, which will take all next year. Holly Hess and the team and the collaborative will be building profiles for each of the priorities, and maybe even other measures or indicators that stand out. When those profiles are built, it's a deeper dive. We'll look into the details, the reasons behind it, the data that's available, what's not available. For example, even simple things like you bring up copays, and it's like all these different kind of segments in the process of paying for a bill. But what happens when the person makes a decision whether they're going to seek that treatment? And in the high-level questions that we're getting back, answers are, it costs too much. Now, that's very helpful to know as a starting point. But beyond that, what does that mean? Does that mean, for example, me, I think, well, it's going to cost me such and such to do this. I can wait 6 months. Well, I could afford it. Is that a problem for me? No. So we need to understand really what it costs too much means and really dig into that. It could be that you can't afford it. I mean, that's very likely.
Commissioner Wright.
Well, and this question might go to the medical community, but if you're there, I mean, to me, cost too much means cost too much. So I'm not sure how much more we have to define that. But as our population ages, and the boomers are a fast-growing group, they're going to go in Medicare. Now, I would have never known this until I joined Medicare myself. But Medicare really doesn't cover hardly anything, especially for the preventative kinds of issues. So let me see, a tetanus shot wasn't covered. Should I have given up the fact that I don't need a tetanus shot? Is that preventative? I don't know. Orthotics. Oh, gosh, that's not covered. Even though I've had orthotics my entire life, I've been in an automobile accident, my ankle is mangled, the foot's not the same, but it's not covered. Let me see, you can do an appeal. First of all, Social Security doesn't tell you who you have to appeal it to. You have no idea of the agency, so you have to do all that on your own. And then if you're lucky enough to find out, you send your appeal in, nobody responds to you whether they actually received the appeal. Let me see, that was a year ago, I'm still waiting. So, I mean, these are the kinds of things that we talk about to say when it costs too much. Things that you're not aware of yet because you're not on Medicare. You're not aware of them because you don't need Medicare. You have another grand healthcare system. But these are the things that normal people, average people, have to deal with every day. And that's why access to medical care is going to be really, really important. It makes no difference if I have a world-famous organization down the block or if I'm going to Olmsted, which is staffed by a lot of world-famous doctors that were trained at Mayo, if I can't say, well, geez, this is not covered. Even when you buy a supplement for a huge amount of money, your supplement will tell you, oh, we don't cover that unless Medicare covers that. So you say, why am I buying a supplement? I think those are the real issues that normal people have when we talk about health care. And that's hopefully what we can find out when we do our study. I appreciate that.
Chair Tyne, Commissioner Wright, I think you raise some really important points of big issue, big system questions. And it may be that to deal with the it costs too much aspect, especially for the Medicare, Medicaid, Medicare aspects, we may need to leverage the county board to engage our federal senators and representatives about that too, because I think that's where those benefits can be best accessed or maybe advocated for. So.
Yeah, and I don't want to make it sound like a downer, but these are real issues that people have. And even I go to Olmsted. Thank you very much. Appreciate that. But even the bills that come through are more narrowly defined now, as if, I'm just looking at an average person. I'm not an accountant. But it's like, gee, how can we bill this so that it doesn't go through Medicare, that I get money? Very likely they're not doing that. But it's very difficult to look at the bill and say, I don't understand why this is outside of Medicare and why it's not covered. And shouldn't somebody be down there fighting for me that it should be covered? So those are the kinds of issues that average people have about their medical expenses.
Commissioner Beer.
Yeah, I think we got a little bit off on a tangent here. I just don't want to leave you guys with the wrong impression. I mean, we really are grateful for your work on these partnerships that we do. And I'm sure you know a lot of the problems that Commissioner Wright is talking, and we're just venting, I think, at this point. But we're very appreciative of the work that Olmsted Medical and the Mayo Clinic does. So, and we enjoy being partners with you. So I just want to temper it a little bit. Sometimes we get a little, and I'm the worst guy on the sport for going off on a tangent. So thank you.
I have a question. So I note that 3 years ago, mental health was in our top three, and it's in our top three again now. And I note that a third of our residents are suffering from mental health issues, and a fourth are suffering from depression. Have those numbers increased? And if so, do we feel that that increase is related to the pandemic, or do we maybe in a more favorable light, some of the stigmas being removed from mental illness, and people are more willing to talk about the issues that they're suffering from? Do we have any feeling on that?
Yeah, Chair Klein, I think you raised some really important points. And in the initial survey that we got, we were able to kind of dig into it a little bit, because some of it, was like cost too much, couldn't get an appointment, couldn't find a provider, and concerned about what people will think was another answer. And we did see that in answers for mental health, and dealing with that issue in terms of stigma is going to be very important, certainly. But I don't know if we've had the chance to dig into and compare. We did a COVID impact survey. It was an opportunity during the pandemic to get similar survey data back. And so we're right now at a point where we're able to, moving out of the pandemic, hopefully, be able to start really putting energy into looking and comparing during pre-pandemic, during the COVID impact survey, the recent survey that we had, and compare to see what can we see from that, what happened during the pandemic in terms of mental health, mental wellness. I'm a father of two daughters. I got to believe, and they were junior and senior in high school at the time during the pandemic, and they lost a lot of, those experiences. I've got to believe, as an example, a lot of people were affected. Yeah, that's gonna cause a problem. So I would not be surprised to see that we didn't have a dramatic increase in issues around that because of the pandemic. So, yeah.
Okay, Commissioner Cascaden.
We're moving next to committee reports, and what I was going to report on was a briefing that I attended last week by the State Health Department. As long as we've got these medical professionals here, let me give my report a little bit earlier. And it really was about infectious disease. And it was the deputy commissioner who was in charge of that unit. And I think we've been so focused on COVID and now influenza. So they gave us the general report on COVID as being an endemic with us, with new variants all the time. A lot of worry about influenza. But the surprise were other disease outbreaks. So measles. I think we've had only maybe 7 or 8 years ago was the last time we had kind of a measles outbreak. And we're having a measles outbreak, not huge numbers yet, but often from people who are doing foreign travel. A little incidental intelligence. I didn't realize that you can have measles and the virus is so vibrant that it can stay in a room for quite a long time after no one's in it, and you can come in and be exposed. So measles. Sexually transmitted disease, particularly an uptick in syphilis, with congenital syphilis happening to 15 cases last year, and then an uptick in HIV. And so I know this isn't part of your direct needs assessment, but and they didn't have it broken out by county, but what I could discern, it wasn't really, I couldn't see. I think they had the measles. Try to remember, two of them, the Olmsted County was mentioned, but mostly it was just high level. So my question is, how do we track and what do we see in our practices here around those kinds of infectious diseases, because we've been so focused on COVID for the last 2.5, almost 3 years now. And there's some concern that with delayed immunizations, we're going to see a big uptick in measles. The other thing that I learned that I was kind of shocked is that we've gone from 11,000 to 9,000 hospital beds in the state in the last 3 years. And that as of last week, the pediatric beds were occupied in our state at 97%. And that's the SARS infection for children, among other things. So what are we seeing right here in Med City around infectious disease?
Yeah, well, another good question. And I'm happy to tell you that in just probably the last 12 to 18 months, we've really been able to strengthen our capability in public health to not only monitor, but to work with our two health partners to get data in more real-time ways to understand not only what's happening in ERs, but also what's happening in terms of diagnosis, to get data quicker. And so our epidemiologists in public health are able to see that sooner and understand what are happening with the trends. And so everything you just named off is probably very visible, and we're able to see it and to the best we can get ahead of it with our medical partners. But all of the infectious diseases can be certainly talked about in that realm, but each of them has their different interventions and preventions and a way to reduce the burden on the community. And you named a few reasons or ways to go after them. But that's ultimately in addition to our epidemiologists on our epi surveillance and preparedness team, we have now also an infrastructure grant, which builds a partnership in a regional way in Southeast Minnesota. It was a grant through the State Health Department that's focused on data and epi through the capacity building of public health. And we were fortunate enough to get that grant to strengthen our epi capabilities to do exactly as you asked about, what are the capabilities in public health, to get that going so we have at least eyes on the situation and can get ahead of it before, it's too great of a deal before we can start acting. So, yeah.
Okay. Well, thanks to all of this. Great presentation. Appreciate the work.
For the work.
Thank you.
Yeah, thank you.
Thank you.
Okay. Now we will go to board and committee reports. Commissioner Flynn.
Nothing much.
Okay. Commissioner Cascade, you have anything left?
Just a little bit more. A little bit more is generally the loss of residential facilities. We've been closing down nursing home beds. I'm told that one of our care facilities here in town has beds closed because there's not staff available. Then we have facilities that have closed because the reimbursement rate isn't adequate to attract staff, and so we've lost care facilities for people with disabilities. But probably what's really on a lot of people's minds right now is juvenile facilities. So the state we're not alone in having closed some of our facilities, and we really do have a big gap in how are we going to deal with adolescents who have behavioral or health problems. And so that will be an issue that is being discussed across the state, but certainly is going to be on our agenda as a county board. And everything I'm hearing from the state meetings I go to is it is a problem everywhere. Every county is struggling with it.
Commissioner Wright.
No report, thank you.
Commissioner Penalty.
Yes, I have just a thing for you to think about for next year. I see that in Ramsey County and starting in Anoka County now, they're doing a thing called a Fix-It Clinic. Residents are invited to bring household goods and clothing in need of repair, as well as any necessary tools and supplies. A team of volunteers, fixers, will make repairs on a first-come, first-served basis. And things that they fix for the community are lamps and hair dryers and sewing machines and toasters, and they fix toys as well. So I thought, why not Olmsted County? Things break here too. So just need to know that Ramsey County's doing it and Anoka County's going to start it. And it might be something the next board might consider offering to the community.
Thank you. Commissioner Beer.
No report.
Commissioner Brown.
Nothing to report.
Okay, before I end with that quote, I think next meeting we're going to recognize our election staff, but we should point out that we just had a election and our staff was under a great deal of pressure and they performed
Yes.
perfectly. I mean, no complaints. Flawlessly.
Flawlessly.
We have a fair election as we always do in Olmsted County and we should be proud of the work they did. So,
While under attack from
right.
several places.
Okay, so today's quote is from early 20th century New York politician attorney Dudley Field Malone. I have never in my life learned anything from any man who agreed with me.
Mark, do we need to appoint?
I'd like to appoint Lisa
And,
Casper
yeah, second.
All in favor, say aye.
Aye.
Okay, can I get a,
to adjourn.
Aye, second.
okay, we're adjourned.
Aye.
Thank you.
Chairman, I'm glad that you keep learning from me.
Are we here? Are we staying here?
Yeah, Mr. Chair, Commissioners, we'll stay here for the committee of December.
A month
We say
ago.
4 o'clock.
Going on some peer review and, okay.